Thank you all for being here. It's good to hear from you. I'm just trying to, Dr. Desborough, just a simple explanation of the money that we've invested so far. And I know there's, my tally shows Johnson & Johnson got $456 million, Moderna's got $483, AstraZeneca was $1.2 billion, Emergent Biosolutions $628. That was all for developing vaccines. That comes out to about $2.76 billion. And then for distribution and manufacturing, Apogec got 138, Corning 204, Valor Glass 164, SiO2 Materials Science 143, for a total about $650 million. So when you put it all together, you're up at around what, 3/4 in that neighborhood so far. What do we get back as taxpayers when this vaccine, when one of these companies or all these companies have a proven vaccine? Are we like a private investor from the federal government? Do we get something in return? Do we get this value back as far as in the vaccine that can be distributed to all of our health centers, or now we have to buy it back?
So there will be future procurements of the vaccine, but to address your specific point, yes, we do receive. So when we are doing contracting for acquisition, we seek consideration to the U.S. government for our previous investment. And it's more than just a dollar per dollar investment. It is also the cost of capital because the U.S. government took the risk to make that investment.
Right. I mean, we're taking the risk the same as the private sector would take the risk, right?
Correct.
So a private citizen would take this type of risk, they get a bigger return for the risk.
Right. So our investments would be taken off the
Our investments are par to what the private would make as far as the return back?
No. So if the company was going to charge $10 for a dose of vaccine, this is just an arbitrary number. I'm not saying anybody's charging $10 a dose for, sale outside the United States. In the United States, the U.S. government would buy it at a reduced price because we've already invested $450 million, to support the research and development.
So basically, we're going to get our value back.
Correct.
Okay. And are we able to control any of the pricing on this too, or be able to put pressure on them not to gouge?
So again, whenever we're negotiating, we always negotiate best value to the U.S. government. We seek consideration. I mean, these are hard negotiations that we have, but yes, we seek best value to the U.S. government.
Well, and I know you've already touched on basically how we're going to get out. The PPEs didn't get out the way they were supposed to get out, as far as we still have problems there, and we're concerned about getting distribution. And I know you all spoke about the community health centers, Dr. Collins, and all that, and I appreciate what you all have done there, but I can tell you they're still hurting very much so, because a lot of the states have not distributed the money that they received as help from the CARES package to keep them viable. And there's money there that hasn't been distributed properly, and we all should be putting pressure on our governors to do their job to make sure our first responders and our county health departments have the necessary funds, and they're not getting it, I can assure you. Rural health. Rural providers have been hit particularly hard by epidemic across the United States. COVID-19 are growing faster in rural areas at 13% than the national rate of 9% for the second week in a row. Rural counties have had the highest number of new cases of COVID-19 in a 7-day period since the pandemic began. West Virginia saw its single-day high just yesterday. So we have 12 hospitals, and all of our hospitals are rural. 12 hospitals already closed, 3 in West Virginia, and we're concerned about the rural health care that we have to distribute. How's the vaccine going to be distributed in the rural areas to make sure that we're able to meet the rising challenges that we have there? Rural providers have the necessary equipment, or they have the personnel to administer the vaccine.
Thank you, Senator. A really, really important question, as you know, and the broader question of how we maintain health capacity in rural America. As I said, there's going to need to be a variety of innovative strategies to ensure that we can get broad distribution, particularly the groups that have been under-vaccinated. You mentioned the rural. We've also had under-vaccination historically in African American, Hispanic populations. And we need to more aggressively, in the H1N1, there was reluctance to fully engage the pharmacies and those opportunities as vaccine outlets. Clearly, we need to expand that in this distribution. There is going to need to be clear interlinkage, as you mentioned, with the community health centers that are there and augment them to be part of it along with the local health departments. But in addition to that, I think there's going to need to be mobile units that are going to be able to go and provide broader vaccination access, particularly in rural America.
Let me just say, my time is up. Rural America basically is getting hit hard now. We knew it would be a delayed reaction of how they're getting hit. But we have the most vulnerable population in the country in West Virginia because of our age and the type of hard work that they've done. So they have underlying health conditions too. And if it hits, it's going to be of disastrous proportions. So we need to stay ahead of that. And right now we had a hard time getting everything else. If we have a hard time getting a vaccine or an antibody when it comes, we're really up the creek. So we hope that you put the attention towards rural and make sure that your associates understand the need for rural.
We're committed to make sure that all those in need get access to this vaccine.
Okay. Thank you, sir.
Thank you, Senator Manchin.